But thing is that, notice that what we have here. So this guy knows his left and his right deltoid. Well, notice that this part, the deltoid is almost kind of like sunken in, right? So he has atrophy. So the thing is that your nerves, even if you're not actively contracting it, you do have some sort of effector signals going to it all the time. This is what we call muscle tone. There is some, it's rare that your muscles are completely relaxed, like nothing's contracting at all. There is some background contraction, but what happens if you damage those motor nerves that innervate that muscle? Well, your muscle is going to lose tone. So that's why nerve damage is typically associated with atrophy of the muscles that are innervated by that nerve that was damaged. Or how about this guy? So look at, he's pretty in shape. He's in pretty good shape, right? But which side is bigger, his left side or his right side? So this guy definitely works out, but is his left side or his right side bigger? Yeah, so notice that his right side, yeah, it's up here and has this pretty big peak, whereas his left side has atrophy too, right? So the thing is that I think this was from a case he did have damage to his rotator cuff and some of the nerves associated with the rotator cuff, and also some of his cervical nerves as well. That's why this left side right here, because the nerves are damaged, he doesn't have as much muscle tone from the damage to the motor nerves that innervate his deltoid. His biceps look pretty similar, but yeah, you can definitely tell in the deltoids that he has a big difference. So this one's more atrophied than this one. Or actually, without nerve damage, if you've ever broken, I've never broken like a bone or like, yeah, like an arm or a leg, but I remember like, what was it? My friend, he broke his, oh, I forgot which, if he broke his tibia or fibula, but he did break one of his legs. But when he took off his cast, the the leg that was in the cast, well, his calf was way smaller and atrophied compared to the right side. But why? Because again, lack of muscle tone, the lack of contraction, and that's what it caused that atrophy, right? That shrinkage. Well, if you don't have that tone, yeah, you're going to have atrophy in that associated area. And this is related to something called Erb's palsy. So Erb's palsy affects two specific spinal nerves, the C5 and C6. And remember that brachial plexus C5, 6, 7, 8, and T1. So it's the most spinal nerves of the brachial plexus. So it's often caused by it's before you even born. So or actually not before you're even born, like from the start at birth. So due to obstructed labor. So what we have here is a baby being delivered, but what's happening here? Well, this poor baby's right shoulder is being snagged. So if this baby is being pulled out with too much force, this can actually cause damage to those nerves that are right here in the shoulder, right? So right here near the cervix, and again, that baby is still developing. Not all the bones are fully formed. So if you damage these nerves, especially these C5 and C6, again, these are the topmost ones, right? They're the closest to the head. That can also damage those C5 and C6. So this is what we have here. So on this poor baby's right arm, this isn't normal. So what you see is that kind of internal rotation, and you see how the hand is positioned. Well, this is what we call waiter's tip, the sign. So this is kind of like that kind of rotation, and you see that kind of like flexion in the wrist and the hand. It's kind of hard to show from the webcam right here. But yeah, you also see atrophy of the affected arm. So here's a guy, and you can see like from his left arm, he probably works out somewhat. And then, but look at his right side. Notice that he's way bigger on his left side, much more muscular than his right side. And notice that he still has that kind of rotation on the inside, right? So you notice that his left arm is kind of relaxed here, but his right hand is kind of rotated internally a bit. So yeah, this is due to this is from birth, this damage to C5 and C6. So again, it's not only just the control, but also the muscle tone and size of those muscles as well. So this is what happened in Erb's palsy. Again, C5, C6. But again, if you take those out, you take out the superior trunk, you take out a lot of half the supply to this cord right here, and also you take out some of the supply to here as well. So this is why it's like the innervation and knowing these plexuses is very important because again, If you damage this plexus, especially if you damage a lot of these roots, then you can have atrophy and loss of control and sensation of the downstream areas.